In the hospital, you might get annoyed by the fact that you get asked the same questions by a number of healthcare providers. There's a number of reasons why we do this, however, one of which is the fact that we're independently confirming the facts instead of playing broken telephone with reports we've heard or notes that we've read. For example, we might ask you a number of times, what brings you in today? Instead of jumping to conclusions and saying, oh, I heard that you have appendicitis. How's that right lower quadrant pain doing? By asking an open question, we're allowing for ourselves to keep an open mind as to what could be going on and also not skewing responses from the patient into a certain direction. Also, for some of us, we have table rounds where we will have a trained attending physician, residents, and medical students all discuss one patient. And here we can talk about what we found independently and see what's going on. That said, we actually had a case where 4 of us from the team had seen one patient, and we weren't exactly sure what was causing the abdominal pain, but by talking it out, we were able to determine a better differential for possible causes. In this case, I had talked to the patient, and they mentioned that their pain was getting worse after meals, and overall the pain was getting worse. I had thought that this could be chronic mesenteric ischemia or ischemic colitis, given that they also had risk factors for this kind of disease. A resident then mentioned, due to the lack of signs of bleeding and chronicity of symptoms, perhaps we should consider chronic gastritis or ulcers. Then our senior resident spoke up and said that afterwards talking with the patient, they described the pain as more stretching in nature, and so they thought that this pain could be due to excess gas and bloating after meals, and so they started them on a medication that would help out with excess gas. Suffice it to say, this patient ended up improving on this medication called simethicone, which helps out with excessive gas and bloating with relatively few side effects and is generally safe in patients. Even though this was ultimately a simple intervention, by each of us talking to this patient, we were able to come up with things that we hadn't thought about before, help improve the care of this patient, and also develop as healthcare professionals. So, the next time you get asked the same question again by a different healthcare professional, hopefully you can think that maybe this is helping your care and also helping develop our healthcare professionals.